Friday morning, and as we have been doing since March, we are going to get a COVID-19 update from the county. With us by telephone today, it's Imperial County Chief Executive Officer Tony Rouhotas and Janette Angulo, the Director of the Imperial County Health Department. Good morning.
Good morning, sir.
Good morning, Carroll.
It's another beautiful day in the neighborhood, right?
Nice and humid.
Yes. Yeah, itchy, scratchy type of a day. But, hey, we won't let that deter us a bit. Okay, I'm going to start off with a question for Janette. Wednesday at a press conference, you announced that Imperial County has petitioned the governor, the state of California, to advance to stage 2, low risk, in reopening the economy. Okay, that's in Sacramento. Things move very slow in Sacramento. Where do we stand right now, Janette?
So, stage 2, low risk. We're still pending a response from the state. However, I'll tell you what's happening and what has moved a little bit faster is that second process that I spoke to you all about on Wednesday, and it's the variance or attestation report. So at that time, I had mentioned that we had notified the state of our intent to file a report, and happy to say that we had our state consultation yesterday, and a report was submitted in the evening. So at this point in time, we're pending state approval because they're doing the final review. So hopefully we hear from them today. And so what that means is that we would be able to move not only through the low risk, but we would be able to move through some of the higher risk stage 2 sectors. Now, something important to remember, Imperial County is on the state's data monitoring list, which I also described on Wednesday. So even if we're granted a variance, and even if we're able to move into other sectors within the stage 2, we have to follow the state's guidance if we're on the state's data monitoring list. So 2 separate processes, the variance attestation report and being on the state's data monitoring list. But progress is being made.
Okay, and right now it is a waiting game. Now, I will point out, as we have pointed out here at Kxo, that Imperial County made it to stage 2 low risk back late June, early July, but it didn't last because people didn't behave, right?
So we started to see increase in disease transmission, increased hospitalizations, and, limited hospital capacity. That started mid-May or so when we started to see the cases accelerate at a faster pace, and so did the hospitalizations. And if we remember talking about hospitalizations, within, a period of 6 to 8 weeks, we had transferred out of county over 600 patients. Our cases, again, they were just increasing at a very fast pace. But it's been, I want to say, 4 weeks or so that we started to see a huge decrease in both hospitalizations and cases. We still see positive cases. We still have some hospitalizations, but we've only transferred out of county a handful of patients, and that's typically what we do anyways because of the need to seek services in other cities and other hospitals. So it's a lot more stable than May, June.
Okay, one of the things when I look at the dashboard that the county publishes daily, go beyond the initial numbers and look at, the number of ICU beds that are in use with COVID patients, the number of ventilators that are in use. And you see they have dropped significantly. The number of positives, it has dropped significantly as well. But that's that's just a small part of looking at everything. As you mentioned back earlier in the summer, over 600 people were moved out of the valley to as far away as the Bay Area and Sacramento. And being on the flight path to the hospital, I'm not hearing the medevac choppers coming in on a regular basis. So.
And that is, you are completely right, Carroll. We receive daily numbers from the hospitals, their inventory, and it's been, very satisfying to see that the number of confirmed COVID patients have dropped significantly. There's a lot more ventilators available, the ICU beds, and actually facility transfers, hospital transfers, there's days that we have none. So that's why you're hearing less of the helicopter.
Okay. Now, stage 2, low risk, would allow what?
So if we go into stage 2, low risk, there are certain sectors that can reopen, and that would be some outdoors. And I have to repeat because we have a state health officer order. So before I tell you the sectors, let me just tell you that there's a state health officer order dated July 13th that includes that if a county is on the data monitoring list for more than 3 consecutive days, then certain indoor activities must close, whether you have a variance or not. And so for Imperial County, we do not yet have a variance. And one other important piece is even if we come off the data monitoring list, and this goes for any California county, we must wait until that July 13th health officer order is lifted or revised, and the state's office has reassured all counties that they're working on making revisions to that July 13th order. So there's, before reopening certain sectors indoors, again, the state health officer order must be revised. Now, going back to your question about what sectors under, stage 2 low risk can reopen, so that would be some of the non-essential businesses, activities, not necessarily indoors, but we would work with our businesses. Places of worship would remain outdoors. So would, some other sectors. We would look at maybe restaurants and try to work that with the state. But now, going back to that variance or attestation report, I think that's why it's important to receive such variance, because then that would open up a little bit more of our businesses. So, for example, all retail, we would be looking at opening with safety plans and social distancing in place, jewelry stores, higher education in person with limited specialized courses, some day camps, some child care, additional sectors. So it just depends on the type of approval that we receive from the state. Okay.
And should we move up to the next level after that? And you said that we're working on that. That will allow even more, right?
Correct. That is correct. Again, so a step at a time, variance, that's the goal since our activity has stabilized quite a bit. Now, what we as a community need to work towards is now the data monitoring list metrics. There's just a few additional metrics that the state has imposed on all counties. We're almost there, so as soon as we're off that data monitoring list, even more sectors would be allowed to open. And again, It also depends on the state health officer's order, which the state mentioned they're in the process of reviewing and updating.
Okay, now, not to throw a monkey wrench in the works here, but Mexicali has said they're going to be reopening bars and other businesses, restaurants, and basically reopening the city because, of course, they do not have a COVID-19 problem in Mexicali. How will this factor in the state's look at Imperial County?
Well, we not only look at what's happening in Mexicali, we also look at what's happening in our neighboring counties and our neighboring state. So it's just like San Diego, Riverside, Yuma, Mexicali. What happens there matters, and we have been, working closely with our counterparts in Mexicali. We receive their numbers according to the information that we've received. They also have seen some stabilization in their hospitals. There's more capacity, and yes, there are some sectors that have been reopening. We still don't receive official information about what other sectors will reopen, so we'll keep you posted on that.
Okay. And, of course, Mexicali to the south and to the east, Yuma in Arizona, and the rules are different. So it does have a very strong impact. Now, San Diego County has moved to the next stage, and they are allowing more in San Diego County. This all will have an impact. Of course, people in Imperial Valley do travel, whether it's south, east, or west. They do travel out of the valley. So it's something that we're going to have to keep an eye on.
You're completely right. So we do need to look out for our own. We need to take care of our house. And if we practice what we've been practicing this last several months, I'm pretty sure we're going to be okay. The businesses have been great. They've been working with the Business Recovery Task Force, trying to get ready for when reopening happens. The many agencies within this community, raising awareness, the campaigns, so that's part of why we are here now looking at, some stabilization or better numbers and percentages, because it's been a joint effort. It hasn't been the public health department. It has been the hospitals, the clinics, the medical providers, the community groups, the agencies, those that deliver meals, and then the community at large, practicing, the social distancing, wearing the face coverings, washing their hands, staying home when they're sick. That's very important. So we just need to keep practicing that to be able to, go back to some sort of normalcy.
Okay, and now I have a question that just kind of popped up. We have noticed, and it has been documented, there are the medical community has been making significant strides from the very beginning of the pandemic. They are sharing information. They are finding out what works instead of just taking a shotgun approach to treating the COVID-19 patient. They now have, kind of a handwritten notebook. Okay, this is what we do. And, oh, by the way, putting somebody on a ventilator, that's not the best thing to do to most patients. Have you seen that trickle down into the valley? It appears it has, because of the fewer hospitalizations, the fewer severe cases.
So the medical providers have done a wonderful job taking care of their patients. And as far as, knowing exactly what they're doing, well, they're professionals and they're working closely with their hospitals and making sure that their patients are safe and providing the right guidance. So we've been actually working very closely with the Medical Society, and I know the Medical Society has been sharing quite a bit of information. they take part in our, it used to be weekly. We just started having biweekly health officer forums that would happen every Friday at 10:30. So yes, our medical providers doing a great job out in the community taking care of our patients.
Okay, what state and federal resources remain in the Valley?
So I'll tell you first what is no longer here. And again, it goes back to, our betterment, our situation improving greatly. So let's start with the Imperial Valley College and the alternate care site. So earlier this week, it saw its last patient. And so what was actually happening before that, because we did not need all the staff, we had a little over 80 staff over at the alternate care site. About half had already been deployed in prior weeks to areas of need. And so this week, the rest of the staff, because we had no more patients in the alternate care site, were deployed again to these other areas where there's an increased disease transmission and hospitalizations. But what remains is the cleaning crew. So they're taking care of the IVC gym, making sure it's clean, but supplies will remain just in case we need to set it up again. Let's hope not. All the supplies for the alternate care site will remain. Contact tracing and investigation team, because we saw such a sharp decrease in cases, the need to do contact tracing and investigation and having a team of over 90 people was no longer needed. We were seeing what was happening in the Central Valley, and so the state asked if some could be deployed. And, we need to be good neighbors, good stewards, and we said, yes, some of them are freed up. And so we remain with 10 state contact tracers and 10 investigators. Now, we do have an agreement up to December, and the understanding was if there is a need, then we would recall those tracers and investigators back. What remains is the testing sites, the COVID-19 testing sites in Imperial, Kxo, and Raleigh. We are seeing some utilization, but they are not booking up all appointments. And each site is able to do at least 132 appointments a day, and that's Tuesday through Saturday. Now, we do have our Emergency Management Services Agency, and through that, it's the normal system. If there was a need for any resource, whether it be state or federal, then we would use our EMS agency system to make those requests. So just a few of the items that we've been supported with.
Okay, stepping down a bit as we begin to make some progress.
Yeah.
Okay. And now, speaking of deployment, redeployment, Chief, Imperial County Fire and other agencies in the Valley have a strike team. It's been split up just a little bit, but what's the word on that?
Yeah, so I've actually been in communications with the guys. They've been back and forth several times, Riverside County, San Luis Obispo, and back and forth. There's been some single resources, and there's a task force currently up that comprises of 4 units and a water tender and a battalion chief from the city of El Centro leading that team. It's an extremely busy fire season, of course, this year. I think the governor was was supposed to be part of a large conference last night and sidestepped to address the issues with the wildfires. It's been a bad outlook on the fire season this year, and there's several large fires burning throughout the state, and it doesn't look like it's going to be slowing down anytime soon.
Okay. And countywide, what else is going on?
Countywide, I can tell you that the cleanup efforts in the township of Nyland are it's a phenomenal job that's happening up there. I've been driving Nyland at least twice a week to take updated pictures and kind of get a good grasp of what's going on. And there's an extreme change of what was there a month ago to what's there today. the actual Rubicon, the agency helping Imperial County clean the property, is hoping to be done by Monday or Tuesday of next week. And the progress that they're making that I saw yesterday looks like they're going to meet that target.
Okay. Sounds good. Anything else?
Yes, I do. I know we've been talking about the variance report and moving, to stage 2, low risk or high risk. But, we need to continue monitoring our data. We need to continue, monitoring, what's happening in our community. We're working closely with the hospitals, making sure that they have what they need. This pandemic is not over yet, and even if we're granted approval to move into stage 2, we really need to continue practicing those great prevention practices, such as wearing a face covering, staying away from others that are not from your household, and if you're going to come in contact, then just stay 6 feet apart. Wash your hands frequently, stay home if you're sick, and just overall take care of your loved ones. We must come together and, and take care of our own hometowns, of our community, and just move forward steadily, but always keeping in mind the health and safety of our people.
And you hit it right on the nail, right on the head there. Moving ahead to stage 2, low risk, or even a higher level, doesn't mean it's over and you can quit. You got to keep it up, because this is not going to go away for a while.
That is correct. And once, the variance is approved by the state and it's posted on the state's website, we will also post it on the Public Health Department's website. In the community, I encourage the community to take a look at that variance report, because it's comprehensive. We're not just looking at the testing positivity percent. We're taking a look at the whole picture and making sure that we are actually ready to move forward. So once it's posted, I encourage you all to take a look at it. Okay.
Janette, Tony, we appreciate the visit today. Got another weekend coming up. It's another weekend of nothing to do, nowhere to go, but enjoy it while you can, right?
Take care, Carroll.
Yep, that's right. Thank you, Carroll.
Thank you, and you both have a great weekend.
There's a lot going on right now, and broadcasters are on the ground covering all of it, bringing you the weather, the traffic, and breaking news, all while entertaining you 24 hours a day. Someone needs to tell you what's going on around the world and in our hometowns, and that someone is us. We are free radio. We are always there. We are broadcasters. Visit wearebroadcasters.com or text radio to 52886 to learn more. Furnished by NAB and this station.
Coming up, CBS News on the hour. The weather, icky sticky, partly sunny today with a high near 107. Heat index values as high as 115. Southeast wind 10 to 15, gusting up to 20 miles an hour. Tonight, mostly cloudy with a low about 86. Southeast winds continuing 5 to 10. Sunny and hot tomorrow with a high near 108. Heat index values as high as 113.
The best oldies on the radio.
12:30.